Okay, the scientific program this year is about bridging innovations into care for allergy and asthma. So it is a novel theme, and we have a lot on the program about also preventing allergic diseases. It's typical for this meeting that we're now going one step further, not only research but also going really into the patient care now with all the novel developments. So we're really bridging all novel innovations into taking care of patients. And it will be about severe asthma, it will be about food allergy, and also about immunotherapy. That are really some of the highlight topics, I should say, that are now really focusing on in the London meeting. Some of the highlights of this year's annual meeting in London will be that there will be sessions about prevention of food allergies, which is kind of novel, and also treatment of food allergy. We have now a lot of new insight, not only how food allergy is developing, but also how we can really prevent it. There also will be special sessions on severe asthma treatment, and for that we will discuss more about treatments with special tools that we have learned from immunology, so-called biologicals, where we can specifically target disease in asthma patients. And the last, what I think is very important, that we're going to look into artificial intelligence. I mean, we now have to deal with a lot of so-called big data, getting data out of all kind of group of patients, and artificial intelligence will learn us how we can translate all this data into treatment of patients. So these are the main topics of many that we will have in the annual meeting in London. I can really invite the people to come over to register for this meeting in London. It will be a fantastic meeting, as what we are kind of used to in the EAACI annual meetings, but this year will be special. It will be about turning points in allergy care. It will be about much more with patients. We will have many novel developments in treatment and even in prevention of allergic diseases. And it will be a fun meeting to go to. It's not only about science, it's also about enjoying being there with the experts of the whole world and getting a lot of things out of that you can implement into your clinic, into your research, or even as a patient you can benefit by knowing exactly what's wrong in your disease state.